I went into the emergency room for another problem. I had chest pains, and I went in for that. And once I found out I was in there for chest pains, it just turned out to be gas in my chest. But they told me I was a diabetic and I had hypertension too. So I didn't know until I went in for another reason.
I kept complaining of a headache to my neighbor, and my neighbor said after 2 or 3 days of this headache that I should probably go to emergency and have it checked out, which I did. Come to find out, I had high blood pressure, and I was pretty young. I was in either 26 or 27 years old.
I was in disbelief, but really, once, you know, my mother has it, my grandmother had it, granddaddy, you know, uncles, I was in disbelief that I didn't want to believe that I had it too.
My family was there with me. I was very happy they were there, and when they left, I began to, I think, worry a lot because I didn't want to be left alone. I ended up having a stroke that night, which I didn't know until the next day because they took me to the neurologist, and he confirmed that I had had 2 strokes.
Probably the most important tip to give somebody who's just been diagnosed with hypertension is that it's a manageable disease. It's not a death sentence. You're going to have to make some lifestyle changes, which tends to be the most difficult for patients to do, is lifestyle changes.
Quitting smoking, cutting back on alcohol use if you use alcohol, making sure that your sodium, the sodium content in your diet is low, because sodium or salt can really contribute to high blood pressure.
One of the things that we do when we talk to our patients about eating a low-salt diet is we have a diagram where we kind of show them what are considered lower sodium foods, moderately sodium foods, and high sodium foods. I don't tell them always to just avoid the high sodium foods, but those are the things they have to be careful of and limit how much of those things they have.
I don't use salt, period.
Okay.
Yeah, no salt whatsoever for me. So the food that I eat is no salt. Like I said, only salt or sodium that I end up eating is if I open up a can or something.
I try to eat the right foods. The salt is not good for me, for anyone with high blood pressure. So I try to stay away from the salts, away from the fats, because you have your kidney, your cholesterol, everything is out of whack when you're doing wrong. And I love those wrong things that are not right for me. So I'm doing the best that I can right now with my foods.
So I'm telling somebody they have an illness when they have no symptoms. And so it's hard to make it a priority when there's 100 other things going on in your life.
You can be completely asymptomatic. You can feel fine. You can feel great. And you can be a ticking time bomb, just waiting. I think whenever I hear about somebody, you know, I was feeling great, and then all of a sudden I had a stroke.
African Americans experience higher blood pressure rates. We don't always know why. It tends to be more genetic, or it runs stronger in families. A higher salt diet, not being able to get the healthy foods, fruits and vegetables, fresh meats that other communities may get. You know, we don't always know what the answer to that question is.
For Hispanics as well as African Americans, their risks are higher, both of having hypertension and the complications from hypertension.
I don't think you really can prevent high blood pressure, especially if it's genetic. If both your parents have it, if all your grandparents have it, and all your brothers and sisters have it, you probably will eventually, unless you're really lucky, end up with high blood pressure. So genetics plays a huge role.
In addition to those risk factors, we also talk about the risk factors if you have high blood pressure. And these are the ones that put you at higher risk of developing complications from the high blood pressure. So heart disease, kidney failure, stroke. And those are the ones that we just mentioned that put you at higher risk of getting high blood pressure. But also cholesterol, having high cholesterol also makes the high blood pressure more dangerous for you, as does having diabetes. having diabetes and high blood pressure together don't just add on their effects, they actually multiply their effects.
Eating a healthy diet, maintaining a healthy weight, and exercising. I have seen patients that have done these things and had a severe family history, a long family history of hypertension, and have been able to stay off blood pressure medicine for a longer period of time than they probably would have if they were overweight, if they weren't exercising, if they were eating a high sodium meal.
Watch out for it. For one thing, like I say, it could be hereditary, or the way you live your life could make you become, you know, have high blood pressure.
I've experienced the high blood pressures, and it is not an easy task. You have to really be careful with what you eat. You'll be able to be very honest with yourself and take your medicine. Do not be a doctor to yourself. You must take it seriously.